purpose of Safety Links is to provide the public with general safety-related information covering the home, businesses, and community with emphasis upon senior citizen-related issues, drawing upon existing programs currently being offered by federal, state, and local agencies. A broad-based, multifaceted array of subjects will be covered. In addition, contact information will be offered to those seeking direct help or support. And now, on with today's topic.
Hello, my name is Tom Hayes. I'm here to really host a special series of Safety Links for SCAN, where we're really talking about Superstorm Sandy and the effects. We really want to help be a resource for our folks out there to help you really learn about what you need to do to prepare for the next storm, as well as recover from Hurricane Sandy. We also are a member of the Long-Term Recovery Committee here in Monmouth County and also in Ocean County, and really, again, are right up to speed with all the information out there. And today I have a wonderful guest, Vera Sansone, she is the COO of Clinical Operations for CPC Behavioral Healthcare, and she will be talking about the services available to the community. Sure. So I welcome you to our SCAN program and Safety Links.
Thank you very much.
It's great to have you. I do have a couple of questions for you, so we'll go through some of those.
Okay.
First of all, can you tell us a little bit about the services that CPC provides?
Sure. We are a large community mental health center in Monmouth County, although we have programs that reach people in at least 7 other counties. We provide mental health, substance abuse, and social services for children, adolescents, single adults, and families throughout the county. We have 3 treatment locations, as well as a very large private school for kids who have emotional and psychiatric challenges. That's called High Point School, and it's in Morganville, New Jersey. The services that we offer range from outpatient counseling, where someone can come in and see a therapist or a psychiatrist if they might need medication, to programs where people can come for the whole day in order to avoid maybe having to go to a psychiatric hospital. Right. So they'd be in our program throughout the day, see a doctor, and get those kinds of services. To groups for people who've been depressed or anxious or other psychiatric kinds of issues. And so that's a general idea. We're open each day from early in the morning until late in the evening, so that we can make it easier for people to come in. And we also have Saturday hours for people who might work outside the area who could use that kind of a
great. Make it
service.
Convenient.
Yeah, we try.
Oftentimes you find programs are just open till like 8 to 5, and it's like, well, that's when we're on work. So,
exactly, right.
So
yes.
It's nice that you consider that. That's
thank
important.
you. And we see a lot of kids and families, and so that really helps, for access to the services for them as well.
Great. And you mentioned the 3 locations. Are they? Do you know what those locations are?
Sure. Yeah, we're located in the Red Bank area. It's actually Middletown, but it's a Red Bank address. Okay. On Highway 35, and we have another office in Freehold and one in Aberdeen. So, and they're pretty large locations with a variety of services in each one. I also wanted to add that we have Spanish-speaking therapists as well, so that we can meet the needs of anyone in the community.
No, that's great.
Yeah.
That's great.
Yeah.
What was the impact on your staff and your clients after this storm?
That's a good question. We've had numerous incidents where staff lost their houses, severely damaged their houses, cars, family members who had to be relocated, as well as many of our clients. We have a large number of clients who live in residential housing that we provide throughout apartment throughout the community, and many of them had to be relocated. In fact, some of them are first moving back to something a little bit more long-term. They were first in shelters, and then sort of a transitional
Right,
space.
so it's been months and
Months, yeah. And, I just, one of the things that I was really impressed by was the fact that even though many of our staff were impacted themselves by what was happening with the storm, they came out to work. We had psychiatrists who were out in the community making sure that people could get their medications. Our staff were in the shelters that were set up and, just trying to reach out despite the fact that when they got home, they had their own challenges to deal with. So, yeah, I was really proud of them.
Yeah, it seems like a lot of folks that were affected seem to react with just getting out there and getting right back in it and helping where they could. And it's amazing how resilient people can be.
And that's exactly
trying to take care of their own problems at home, and they somehow fit that in while they're doing their day-to-day work.
Absolutely, yeah. And that's the resiliency. I mean, some of our kids are living with families where there are, large numbers of people living in the apartment because they were displaced, and still they come to school and they're interested in doing all the things that they were doing prior to the storm, which is great.
Right, trying to get back to normal,
Absolutely,
right?
yeah.
What funding have you received to help?
We were really fortunate. We were able to secure a loan from, a grant from the Robin Hood Foundation.
Wonderful group.
Wonderful group. They're the people who brought you that wonderful concert right after the storm. And so what we decided to do with the money that we got from the Robin Hood Foundation was to be in the communities that we work with a lot anyway, but that were severely impacted by the storm. So we were able to set up locations in Keensburg, where we can also address the needs of people from Union Beach, in Highlands, which would also mean that Atlantic Highland people could come to that location, and in Seabright. And these were areas that were seriously impacted. In fact, didn't have any electric power until very recently. Many people are still not living in the town, but come back, working on their houses and stuff. And so what we were trying to do is have evening hours and weekend hours so that people could come to the locations and see someone for help.
Nice.
And we're also trying to do it in a way where, because a lot of people who had no prior history of psychiatric issues might now need,
Of course, it's huge.
And there's a stigma attached, to seeking mental health care. So what we're trying to do is have maybe a movie and invite people out for that, or a potluck dinner, and get to know people in the community and sort of educate them about what might be happening with them that they might decide that they could use some help with psychiatrically, or just to talk to another person about what's been going on.
Right, and they might not even be aware because, like you said, they haven't had a history of
Absolutely.
that. So
or embarrassed.
Fresh and new, and they might not even be realizing what's quite going on with themselves.
Absolutely.
There's a lot of stress, I'm sure, involved with all that.
Absolutely. And people who have had, say, losses in their lives, sometimes something like a tragedy like this can bring up a lot of feelings that they've had from past losses. Kids are very much susceptible to issues. Someone who might have a substance abuse issue in the past, this might be a trigger for a recurrence of those kinds of problems. And it's totally normal in terms of, as far as anything's normal, in terms of the way that the storm can affect and what they're dealing with now and trying to get back on track. So we're there, and we can provide individual work, family work. We just want people to feel comfortable with us. One of the other things that we're doing is with some of our clients who have more significant mental illness issues, have had trouble just filling out the forms, because there's so many of them, and so we've been helping those clients with, just being able to reduce some of the stress by helping them with those kinds of things.
That's great. Really appreciate it. I mean, it's great work that you do, and it's certainly an important element to this whole recovery issue. And we know more than ever those programs and all the assistance that you have to offer is needed more than ever throughout our entire community.
Yeah.
A lot of people are affected in a lot of different ways and at different levels.
Absolutely.
So we very much appreciate the efforts that you're doing out there, and we really, again, thank you for being here with us today.
Thank you.
And
Thank you for having me.
we wish you great luck going forward.
Thank you.
Thank you,
It's been a
Vera.
pleasure. Thanks.
Have you ever considered, I don't know, getting it waxed?
Wax.
Yeah.
Bro, that's a little weird.
I don't know. Doesn't seem that weird to me.
Just keep shaving my back, okay?
Oh, dude, can I get a bite? What? With my spoon? This is disgusting.
Hello and welcome back to Safety Links. Again, I'm Tom Hayes, and I'm here with a wonderful guest that we have with us, Jim Romer, who's Director of Psychiatric Emergency Screening Services for Monmouth Medical Center, Barnabas Health Facility. And we welcome you to the program.
It's a pleasure.
Appreciate your being here on Safety Links. And we've been doing these stories basically on the aftermath of Hurricane Sandy or Superstorm Sandy. So we appreciate your being here. We're going to ask you some questions and get some information that we know is going to be helpful to our listeners. First of all, even though some of the time has passed since Sandy, are mental health issues still a major concern in this community?
You know, it's kind of interesting because we associate crisis with a catastrophic event and so upsetting at the time. But I think a lot of the research over the years, even with the experiences of Katrina, basically have taught us that there's almost a delayed reaction for the emotional impact to set in. And I think some of the issues they saw in Katrina is months afterwards, sometimes even years now. Afterwards was when it finally settled down, when people have really taken stock of the concrete losses they've had, and now things have settled down, and you know, you get beyond that rescue rebuild mode, and you know, and now, wow, what did I lose, and how much that took out of me. And I think if you already have problems, it exacerbates it. If you already have substance abuse problems, chances are it's going to make it. It's not going to make your problems better. It's going to make your problems worse. We've seen increases in domestic violence, increases in suicide. So I think we see some resiliency immediately afterwards, and people come together. But I think after a while, I think the long-term effects, and along with that, there is a connection between that and the emotional does impact some of the health care issues. You see that spike in medical illnesses and complications. So.
Right, it reminds me of almost like after a funeral, you're getting all the preparations ready, everybody's coming to visit, and everybody's around and helping, and the food is coming and all this, and when everybody goes away and it starts getting quiet again, it settles down, you get just right in your own world, then it hits you.
Absolutely. Absolutely.
Why is it important to identify emotional and psychiatric issues related to a disaster, do you think?
I believe that the importance of that lies in the fact that of what do we do about our feelings? What do we do about it? And I think to understand, for example, why I'm not sleeping, why I am I have a short fuse with my kids, with my family, at work. Why do I seem distracted? Why aren't I doing healthy things? I used to exercise 4 times a week before. Now I don't exercise anymore. You kind of let yourself go to pot, so to speak.
You sit on the couch.
And again, worst case scenarios. Why do I have to drink myself to sleep at night? Why do I have to? My eating habits become terrible. I mean, we see people, for example, whose diabetes has been under control for years. After a traumatic event like that, they're in crisis again. So there's a distinct connection between the physical, medical, and emotional, psychological, distinct connections.
Right, and I think we probably all can think of a time where, you know, you went to whatever that might be. For me, it's probably junk food or something.
Yeah, absolutely. And we all have it. I mean, we all have our unhealthy habits.
Yes.
You know, and anybody who would say they don't is lying. I mean, there's nobody. But I think but I think the important thing is to recognize it and recognize what it's doing to me, because these are things that are going to, in the long run, make me. I may sleep better tonight, but in the long run, it's going to make me weaker. It's going to make me less able to manage my stress. Right. And it's going to hurt me.
So if you're aware and at least acknowledge it to start, that's a start, right? So then you can start getting help for it and all that. Yeah, that's good. What types of disorders are common following a disaster? Those types that you just mentioned, where is that where the sleeplessness?
I think you'll have, again, I think you're going to have what we call just clinical depression. And I'm just, I mean, you lose your house, you're going to be sad, you're going to cry. I mean, depression is one of the most misunderstood diseases in America today. It's not just being sad. Sadness is not a disease. But basically, we know there's a connection between that kind of stress and the biochemistry of the brain. And clinical depression basically is, I just can't function. All I do is sleep all day, or I can't sleep, I can't concentrate. I literally can't enjoy, you know, my family, my hobbies. You kind of disconnect. There's no energy. So that's one of the things we see, depression. Obviously, if you've experienced that loss and that stress you might have, you know, that those images, those memories will come, you know, they'll come pounding back. I want to be very careful about using clinical terms here. We talk about post-traumatic stress, you know, and that's not just veterans. That's not just Rambo. You know, it's anyone. We talk about that as when extraordinarily bad things happen to ordinary people. You know, it's not natural for a parent to bury a child. That's extraordinary. It's not, and it's not, we're not built to have a storm come out of nowhere and lose everything we've worked for in 20 minutes. You know, and that's, you don't just toughen it up and say, you know, all right, you know, I'm tough enough. No.
And it's one thing to lose your home, like, you know, your furniture and stuff, but you've got your photographs and videos and all those kind of things, those emotional things that you may never have even looked at, but now knowing that they're gone.
I experienced that in my own family once. I have an aunt and uncle, and they're wonderful people, and they were in their 60s about 20 years ago, and their house burned down. And they were very meticulous. They had good insurance, and they had all of their things replaced, even better. The house that was rebuilt and their furniture was even better, but you don't replace the pictures of your kids from first grade, and the little things, little cards that they made years ago. You don't replace, and that takes a toll. That takes a serious toll. That's that emotional impact, and it was no accident that and my uncle was very, very healthy. But shortly after that, he developed serious cardiac problems, and there is a connection. There clearly is a connection with that, and we tend to think of crisis as, you know, catastrophic, but it's very individual, and a person loses, you know, you hit the nail right on the head there. You lose these special things, these little treasures that we all have in our houses. We all have in our homes. And as you get older, those treasures accumulate. And they have more of a history, and that history's gone. You know, and you can replace it. And I think part of what happens is you get the check from FEMA, you rebuild, and then you're sitting there in this brand new place that smells good, looks good, even looks better than it was before. But what's missing? What's missing? So,
and I would imagine that this would affect all ages.
Oh, absolutely. In different ways. It's a little bit like you won't have especially a little boy. You won't have a little 7-year-old or 10-year-old boy say, "Gee, I'm depressed," or no. They're gonna act out. They're gonna you know. I mean, with children 6 and 7 years old, these losses, you have almost regressive behavior sometimes. These little kids now 7, 8 years old, all of a sudden they're crawling back into the bedroom with mommy and daddy at night. You know, in extreme cases, there's bedwetting, and again, that starts. arts and acting out, distracted in school. And I think it's very, when we have an individual child who's had a loss, one of the things we tell, let's say they lose a parent, one of the things we really emphasize with the mom or surviving dad is make sure the school is on board. Make sure they know exactly what's going on here. So the most part, the schools are the most important environment for the children.
That's true.
And it's important for those teachers and that staff to know that this child has gone through what probably 30 other kids in that class haven't gone through.
Right.
But I think what's interesting here is that we have so many children that were impacted by Sandy. And I'll put a plug into what we work very closely with schools, and they've actually been in both Monmouth and Ocean County. The schools have done a wonderful job in being a real life raft.
It's great
for kids.
It's great that they appreciate that position and accept it and do the right thing.
And agencies like ours in St. Barnabas and agencies like CPC, one of our roles is to support that effort in the schools. And we work hand in hand with them. So.
Another question, what are some of the indicators of depression and anxiety that people can look to for themselves and loved ones?
Sort of mentioned it before, and I think, again, we got to get away from this idea, this myth that sadness is depression. You have a major loss, you're going to be sad. That's normal. If you weren't sad, there'd be something wrong. So what we look at with depression is we look at disturbance in my ability to sleep, a concentration. I can't, literally there's people who talk about they can't taste food anymore. There's no enjoyment, there's no pleasure. I can't take pleasure in anything. And there's actually biochemical processes that actually occur that inhibit my ability to taste food, experience pleasure. I think one of the things, a lack of energy, one of the things we talk about is we encourage people to go into therapy, but a person who's really clinically depressed can't even sit through a therapy session.
Wow.
They're just unplugged, and that's where psychiatry and mental health professionals work, to deal with the medical disease of depression, so that I can, to put the plug back in, so that I have the energy to actually get back on my feet and do what I need to do. And also then I'm also prone to some of the more what we call maladaptive things. People who are depressed are prone to drink too much, eat too much.
And I guess in terms of getting assistance, sometimes that can be in terms of therapy, but then there's also medications, right? And depending on the situation.
Getting assistance, and the problem with getting assistance is that, and I think Vera referred to it before in the other segment, there's a tremendous stigma. All right.
People too proud.
I think if I go to see a mental health professional, if I go to see a psychiatrist, everybody will think I'm crazy. And I think that's one of the hardest things for mental health professionals and mental health agencies to deal with. This whole idea that there's some crazy thing going on. And that's especially true in older generations. And very often in depression is so common in the old. It's epidemic in the senior population. I mean, people are shocked to hear that the highest rate of suicide in the United States by far are senior citizens.
Wow.
And people are shocked. Oh, I've never heard of that. That's odd. But I think part of that is that 75-year-old man is very reluctant to sit down and say, I'm depressed, I need help, let's talk about it.
Never gone for help.
I'm not going to do that.
Right.
So.
And you're right. I think in this day and age, we're a lot more attuned to it. We hear more about it. We understand it more. We realize it's not anything to be embarrassed about or ashamed of. It's just the thing to be embarrassed about would be not getting the help.
Absolutely.
Right? So now you'd say, well, why would I be spending my time, maybe affecting my family, myself, my work, and all that when I can just go get some help and get through this, which I think is also very important. What are some of the things people can do for themselves or loved ones too? Like if you see that there's somebody that's having an issue that maybe isn't coming to grips with it themselves, what do you suggest to folks like that? What do the family members do?
I think the most important thing is to consistently remind people that I care about you. The door's open. you can't force anybody to walk through the door.
Right.
And sometimes the more you try to force it, you push people away. I think it's very important for a person going through crisis to realize that, anytime you want, I'm here. Because what people need actually is like, and I use this kind of analogy, it's like we're all out there in this big pond, and when things get rough, the more life rafts we have in the boat, the better off we are.
Sure.
And the more things to hold on. And that could be church. Whatever works for me is basically, because somebody once said crisis is that point where everything that's worked for me before doesn't work today.
Gotcha.
So the more options I have, the more lifeboats I have out in the lake,
Right.
I can, the better chance I have of not drowning. That's what it comes down to. And it's very individual. For some people, the lifeboat might be church, it might be my family, it might be my wife, it might be friends, it could be a bowling team.
Right,
for goodness sake. I mean, and part of that is the professional.
Right.
I think part of that is you're always there, because I think sometimes people in crisis don't want to burden people they love.
Right.
Or they don't want to. Like, they think if I talk to my wife or my husband, or I talk to all my friends, that's what I'm going to talk to them all about. The nice part about professional people is
that's what they
don't have to care about them. They're being paid for this. It's kind of a neutral thing. They very much are the consumers, getting a service, and but it's just another life raft in the water.
That's important.
And sometimes people do reach the point where they need that, quote, professional help.
Right.
When they can't function anymore.
Right.
When it's reached a point where, as I said before, with crisis, where nothing's working. I go to church, and I like to go to church, but it's not working.
Right.
And my
sometimes
friends are.
You need somebody.
At that point, you might need an expert to tell you maybe there is the beginnings of an illness here. That's part of it. Just like chest pains.
Right, and I think for most of us, we know, 911 for emergency, or you might have your fire department number handy, or a police department number handy, and most of us may not deal with these issues that often, so having that number handy and all that, I would certainly suggest to our viewers that, you make sure you have that information handy when you need it, and hopefully you never will, but if you do, it's nice to know where to get those services.
Our system, and I'm not, but our system, I currently am the director of our crisis unit at Monmouth Medical Center, and the state has designated 24-hour-a-day, 7-day-a-week crisis services in every county. We're state designated, supported by the state, and Barnabas has 2 of those contracts in Monmouth County at Monmouth Medical Center, and in Ocean County out of Kimball Medical Center, and if those numbers are readily available, I don't know if we're giving them out, but those numbers are readily available. And that's 24 hours a day, 7 days a week.
Which is great.
And those phones have to be answered by professionals. So that, and if you're sitting there with nobody to call at 3 o'clock in the morning, it's an option.
Right.
And
it's private. It's it's going to stay with them and all that. And sometimes it's a matter of just getting something off your mind or what have you, and maybe they can talk you through something. But at the very least, you should reach out so that if you need even more extensive assistance, you have to get it.
And the people in the crisis screening centers can help connect you to other services.
Right.
We have outpatient services, over here at Monmouth Pollock Mental Health Clinic. We have there are an array of outpatient services in the county. We have outpatient services in Toms River. So I think we can. It doesn't necessarily have to reach the point where it's such a crisis somebody has to be hospitalized.
Right.
Our system, we have 3 psych inpatient units at Monmouth Medical Center. We have a large inpatient unit down in Toms River. But
this is great.
We don't want it to reach the point where people wind up in a facility like that. They don't have to. So
that's great. Well, I really do want to say, first of all, the whole Barnabas system is great. You guys do wonderful work in the community, and I thank you for that. I also want to thank you for being with us today.
It's been a pleasure.
I appreciate it. It's great to see you, and always good to get that kind of information out to our folks that need it. So thanks again, and hopefully we'll see you soon.
Well, it's been a real pleasure. Thank you.
Thank you.